Welcome. My name is Jeff Malmgren, and this is a PCN DOCTALKS on the COVID vaccine. We're fortunate today to have Dr. Baldev Sangera from the Burnaby Primary Care Networks. Dr. Sangera is also on the South Asian COVID Task Force. He also heads up the Prime Care, the Prime Care Clinic in Burnaby and the Urgent Primary Care Center there. And is very involved in the primary care network's work in Burnaby and in the COVID response. And we also are very fortunate to have Wael Sideros, who's a settlement worker with ISSBC, who will be translating today the session into Arabic on a separate channel. I do want to remind people that this is an interactive session. If you have questions, please put them in the Q&A box, and we'll ensure that Dr. Sangera gets time to answer them. This session is being recorded and will be available on the burnabypcn.ca website in the time after it's ended. And now Wael will leave for that Arabic channel, and I'll turn it over to Dr. Sangera.
Thank you. So I'm going to share my screen with you, and then we will be able to start the presentation. So welcome everybody. My name is Dr. Baldev Sangera. I am a family physician in Burnaby. And what we're going to talk about today is everything that you need to know about COVID-19 and the vaccines for it. So COVID-19 is a virus that comes from the family of viruses called coronavirus. COVID-19 is spread in the air. So when we speak or we cough or we sneeze, the particles get spread in the air and through water droplets. The virus can cause lung infection. And once it gets inside the body, the virus can then infect other organs. By that, I mean that it can cause heart inflammation, kidney inflammation, brain inflammation, lung infection and inflammation, as well as liver inflammation. This virus can also cause lots of muscle pain, tiredness, and fatigue. Around the world, this virus has caused about 2% death rate. So as many people that get infected, 2% have died. 30% of the people that have had the COVID-19 infection and recovered, unfortunately, are left with long-term symptoms. And those symptoms can vary. They can be as mild as fatigue, but some people have had other longer-term impact on their lung function and heart function, as well as on brain function. This virus has impacted the whole world. I will now share with you some of the data about the cases around the world. As of yesterday, we have had a total of 178 million cases in the world, and every country in the world has been infected. There's not a single country that can say that they are free of COVID. Since the pandemic started at the start of 2020, unfortunately, we have lost 3.8 million people around the world to this disease. And a little bit of good news. We have started to vaccinate people in many countries. And around the world, we have given 1.35 billion first doses of the vaccine and approximately 30 million second doses. In Canada, we have had a total of 1.4 million cases since the beginning of the pandemic, out of which, unfortunately, we have had 25,644 people die. In Canada, our vaccination plan has now started to roll very well. We have given 31.2 million doses of the vaccine, of which 66.2% are first doses and 16% are second doses. In BC, in April of 2021, we were seeing approximately 1,000 COVID cases per day on average. And as of yesterday, we have an average of 120 cases in the last per day in the last week. The positivity rate has decreased to 2.5%. In March, April, we were seeing 20 to 25% positivity rate in some neighborhoods. As of yesterday, we had 131 people in hospital, of which 44 were in the ICU in very serious condition. The number of people being admitted into the hospital during March, April, May has caused a serious impact on the hospital function. This has resulted in approximately 1,000 surgeries being postponed per week until we are able to get the COVID under control. In BC, we have had 1,739 deaths since the start of the pandemic in 2020. Total number of cases is 146,794 in BC. So our overall death rate is slightly lower than 2%. We're at about 1.5% because of the way that we have controlled the spread. Currently, BC is actually leading the world in vaccination, and we have given 3.4 million first doses of the vaccine, giving us a 76% coverage for first doses. We have also given 770,000 second doses, which translates to 15% coverage for fully vaccinated British Columbians. We are leading the world in first doses, but we have a lot more work to do to catch up with the second doses. The chance of infection from COVID in BC in April was 1 in 4,700. Now, if you remember, when we had a lot of cases, the chance of death from COVID was higher as people got older. So the statistics I have on the screen show when you're under 55, the chance of death is about 3.2%. As people get older, their risk of dying goes up. And over 85 years old, your risk of dying once you get COVID is 68.3%. Of all of the people that have died in Canada in the last year, 80% of them were over the age of 65. Long-term symptoms that we have seen from the people that have survived, and I had mentioned earlier that 30% of people are left with long-term symptoms. Those symptoms include lung issues where you have difficulty breathing, muscle weakness, brain fog, and that's where you have difficulty remembering things, difficulty concentrating on your tasks, and poor circulation in your hands and feet, as well as anxiety. So the virus actually causes an increased anxiety. How do we protect ourselves from this virus? How do we protect ourselves from getting the infection or spreading the infection? So one of the best ways that we can protect ourselves, our family, and our friends, our colleagues and neighbors, is to wear a mask. Anytime that you leave your house, wear a mask, wear it properly. When I say wear it properly, it means covering your mouth and your nose. So you have to cover up to here, not leaving the nose outside. That leaves the nose open for the virus to get inside. We need to keep a minimum 6-foot distance from people, especially if we are in crowded rooms or if we are in a place where there's poor ventilation. We are advised to wash our hands to prevent spreading the virus. And finally, we are recommended to get vaccinated. By doing all of these 5 things, we can get this pandemic under control and get back to life in a normal way. Which vaccines are available in BC? Currently, 3 vaccines are available. One has been announced and approved, but not available. And one more has just been announced that it may become available depending on the data. Studies are ongoing for that last one. So the 2 first ones that I'm going to talk about are made by the company Pfizer and the company Moderna. These 2 vaccines are of a type called messenger RNA, or short mRNA. These vaccines have a small protein code in the medication, and it is injected into the body. The immune system reads that the protein code and makes antibodies to fight the infection. Once the immune system has read that protein code, the protein code is destroyed and eliminated from your body in about 8 hours. These vaccines are halal, they are kosher, and vegetarian. So there are no religious restrictions for anybody for receiving these vaccines. The next 2, both the Pfizer and Moderna vaccines are available at all vaccination clinics in BC. The next 2 vaccines we will talk about are one made by the company AstraZeneca, and the other company is Johnson & Johnson. These 2 vaccines are called vector vaccines. Instead of a protein code to boost our immune system, they use an inactivated virus, which is dead, and that dead virus then transmits the code to our immune system to learn on how to build antibodies. This is the same technology that we have been using for flu shots for many decades. These vaccines are also, they do not contain any animal products. So again, are safe from a religious perspective to use. The AstraZeneca vaccine was available from pharmacies before for first dose for people born in 1981 or older. We have very limited supply of this vaccine now. So the limited supply is being reserved for people that wish to use this vaccine as a second dose. The government has not released the Johnson & Johnson vaccine for use right now, and it's still undergoing some testing. Novavax is a new vaccine that has been undergoing some trials. It has passed first and second stage and the third stage trials as well. We do know that it is very effective and safe, but it has to go through a final approval stage before the government will release this for use at the vaccine clinics. We expect Novavax to be available by the end of the year. All of the vaccines that are available in Canada currently require 2 doses of the vaccine to be fully effective. 1 dose gives you 30 to 50% effectiveness, and a second dose boosts that up to 90% effectiveness. We have seen very, very good results from all 3 vaccines around the world and also here. We have seen, because of our high dose, first dose vaccination program, we have seen the number of people getting infected drop by 90% here in BC. When somebody goes to the vaccination clinic to get the vaccine, you are expected to have some minor side effects for about 48 hours. Those common side effects are where you get the injection in this upper part of the arm. You will have some discomfort at the site of the injection. The following day, you may feel tired. Your body may feel achy. You may have a mild headache, fever, and congestion. Some people also report stomach upset. These are expected minor side effects, and they usually clear up after 48 hours. If needed, these side effects can be treated with Tylenol, or the other name for Tylenol is acetaminophen. The mRNA vaccines from Pfizer and Moderna have a chemical called polyethylene glycol in them. Some people, and this is very rare, but some people have an allergy to polyethylene glycol. It is recommended that those people do not use the mRNA vaccines. Most people have been exposed to polyethylene glycol in food, in makeup. So if you have not had any reactions to those things in the past, you will not have a reaction to the vaccine. If you have allergies to grass, to pollen, to dust, to penicillin, no problem. You will not have allergy to these vaccines. Some of you may have heard that the AstraZeneca vaccine is associated with rare blood clots that can occur in the brain. The technical name for these blood clots in the brain is vaccine-induced thrombotic thrombocytopenia, or other letters that are often used for describing that are VITT. Basically, that is a small blood clot that can form in the brain after day 4 and up to 3 weeks after the vaccination. If somebody receives the AstraZeneca vaccine, they should monitor themselves for the onset of very severe headaches and vision change for 3 weeks. After the 3 weeks passes, there is no further risk. If somebody does have a very severe headache or vision change, please advise your family doctor, who can then do some very simple blood tests to identify what the problem is and then provide a treatment. Before we knew what this side effect was, it was worrisome. Now that we know what the side effect is, and it is rare, it occurs in 1 in 100,000 people, and we know how to treat it, we are not as worried about this side effect anymore. In comparison, other things can also cause blood clots. If you're not vaccinated and you catch COVID-19, the risk of getting a blood clot is 1 in 100, in comparison to the side effect of 1 in 100,000. So COVID causes much higher risk of blood clots in the brain. This is why we want to prevent that from happening. When women are pregnant, their risk of blood clots is 1 in 300. So again, the need to prevent the COVID-19 infection is much more important. According to Statistics Canada, COVID-19 has caused, in 2020, has caused more deaths than any other disease except for cancer and heart disease. Some of you may have heard of news from friends or from the internet, from social media, about problems with the vaccines. So I will now talk about the more common ones that I have heard of in the media. The vaccines do not cause any hormonal problems or problems with menstruation in women. There is no link. Some people have been afraid that the vaccines cause infertility. This is not true. There is no impact on the ovulation or fertility in women. In fact, in men, studies have now shown that after vaccine, men's sperm production increases. We have lots of evidence now that these vaccines are safe in pregnancy. In fact, it is recommended because of the risk of blood clots in pregnancy with COVID-19, it is recommended that women get the vaccine either before getting pregnant or as soon as they find out that they are pregnant, they should get vaccinated to protect themselves and the developing baby. We have lots of evidence showing that when a baby is born to a mother who has been vaccinated, the baby naturally has antibodies to fight COVID-19. And this will save the baby from having to have another vaccination. And lastly, I have heard many stories that Bill Gates has been putting microchips into the vaccine in order to control us. And this is not true. We are tracked and monitored more by our cell phones than by anything in the vaccine. The vaccines have not been created to control population. There is no poison in the vaccine that is to kill people. Vaccines are safe. They are there to protect all of us. The advice from Health Canada and the National Advisory Council on Immunization, or NACI for short, the advice is that the benefits of the vaccine far outweigh any risks to the majority of people. Your risk of being infected with COVID-19, being hospitalized, or dying far outweighs any risk of any rare side effect. The recommendation is please get your vaccination and accept any Canadian approved vaccine that is offered to you at the vaccination center. They are all equally effective. Out of the 3 vaccines that I talked to you about, the Pfizer, Moderna, and the AstraZeneca vaccine, in all of the people that have been vaccinated with 2 shots, not a single person has died. There has been a 95% reduction in those people going to the hospital. And there is a 90% reduction in transmission of any virus from one person to the next. These vaccines are safe. Please get vaccinated, and let's focus on getting you healthier and get life back to normal. Currently in BC, we have 3 vaccines available: Pfizer, Moderna, and AstraZeneca. All 3 vaccines require 2 doses, 8 weeks apart. So the gap between dose 1 and dose 2 should be 8 weeks. It can be longer, but not closer than 8 weeks. Vaccination is not mandatory, but it is recommended. And in the future, what I have heard is that some jobs where you may be exposed to seniors or people that have weaker immune systems, you may be required to get the vaccination before you can go to work. If you have received a Pfizer or Moderna as your first dose, it is recommended that the second dose be either Pfizer or Moderna. You can mix and match these two, they are equivalent. If you have received AstraZeneca as your first dose, then you have choices. The second dose can be AstraZeneca, Pfizer, or Moderna. NACI, the National Advisory Council on Immunization, is recommending that the second dose be Pfizer or Moderna. But you have the choice that if you choose, you can get the AstraZeneca. But NACI has advised yesterday that the Pfizer or Moderna as a second dose is recommended so that we get better coverage against the variants that are coming of the virus. The other reason to recommend the Pfizer or Moderna vaccines as your second dose is that there's a limited supply at the pharmacies of the AstraZeneca vaccine. So how do we get vaccinated and get everything back to normal? First step is to register with the Ministry of Health, and then once you have registered, you will receive a code to book your appointment. On the date that you have your appointment, go and get vaccinated. We can register in two ways. We can call 1-833-838-2323, and you can actually have access to a person on the other side in multiple different languages. Translators are available in, I think, about 15 to 20 different languages, and they will try to accommodate any requests that you have. If you have access to a computer, you can register online by yourself. The website is getvaccinated.gov.bc.ca/s/. So the key step is to register, make sure that you're in the system, and then you will be able to either make a booking for your vaccine, or if you still need your first dose, you can just drop in at the Fortius site on Kensington Avenue, and just walk in, get your vaccine same day. But you have to be registered first in the system. There is no need to have MSP or PHN number, even if you are a visitor, immigrant, you are a student, an international student, or even if you're illegal. We do not care. We just want you to be safe, and your information will be kept private, will not be shared with the immigration people. You do not need to worry about anything. But please get vaccinated. We are in the process of trying to arrange for some smaller clinics in various different neighborhoods. And please continue to follow up with WILE or any of our community organizations for further information as those clinics are announced. If you require a drive-through option, the drive-through clinic is at BCIT. I believe that's the end of my presentation, and I'm happy to answer any questions that anybody may have.
Thanks, Dr. Sangera. That's great. There are a couple of questions that have come from the folks on the call, and I have a couple myself. First one is the one that always seems to come up. Can I choose what I take, Pfizer or Moderna?
Right now, I don't think we can choose. They have certain supplies going to different sites. I think depending on which vaccine they have on that day, there's no choice. But in practicality, there's no reason to have a choice. They're both excellent vaccines. They're equivalent. It's just two different brands. It's like trying to choose between BMW or Mercedes. They're both very, very good.
Maybe we can talk about the Ford and the model. The AstraZeneca piece that you talked about, NACI's recommendation around taking one of the mRNA vaccines as your second dose. Was that based on safety, or was that based on the efficacy of the combination against the variants?
So it's actually, they looked at all of that data, the safety data, and this is looking at many hundreds of thousands of people in Europe, and they did not find any safety issues with the folks that got AstraZeneca first and then received either Pfizer or Moderna second. There were no safety issues there. The only thing that they did find was that those minor side effects that I talked about, where you have pain at the injection site, achy body, tiredness, that is more likely to happen with the second dose if you got AstraZeneca first and Pfizer or Moderna second. If you had AstraZeneca first and you get AstraZeneca second, there's a lower chance of that. It's still going to happen, but not as frequent.
Not as much, but really, this is not a caution against taking AstraZeneca because of the safety issue of taking AstraZeneca.
No, because if you had your AstraZeneca as a first dose, the risk of the blood clot occurring was 1 in 100,000. With the second dose, the risk is 1 in 600,000. So the risk is reduced anyway.
Yeah,
right, and a very significant difference. The other part of your question was about the efficacy against the variants of concern. So that data has started to come out now. It's not a large study, smaller studies of a few hundred people, where they have shown that each of the vaccines has slightly different effectiveness against the different variants. So we have alpha, beta, gamma, and delta. All of the vaccines are fairly good at protecting against alpha. AstraZeneca has a very good effectiveness against alpha, beta, and gamma. The Pfizer and Moderna vaccines have a slightly better effectiveness against all alpha, beta, gamma, and the delta. Currently, delta is spreading more in Europe and also in the US. We are starting to see a few cases here. I think the last time that Dr. Henry had discussed this, she had mentioned that there were about 500 cases of the Delta variant in BC, but it had doubled in about a month. So we are concerned. There are Delta variant cases in Alberta, and we are concerned that they're going to spread from Alberta to BC. So hence the recommendation to get the vaccine that's effective against that one, Pfizer or Moderna.
And not only that, but to get the second dose, because
you absolutely need 2 doses. Yeah, 1 dose. The alpha, beta, and gamma variants you can control that with 1 dose partially, but the Delta variant is not controlled with 1 dose. And so it's been very, very clear from Europe. In England, in the last month, their cases had gone down, and now they're starting to go back up because a lot of people did not get their second dose.
So just along the conversation about variants, we have alpha, beta, gamma, delta. Is epsilon on the way?
Possibly. And so we have to look at other parts of the world where virus transmission is not being controlled. So the Delta variant was first identified in India after India was unable to control spread. And if this continues in any part of the world where the countries are not able to control the virus spreading in their location, we are going to see new variants. In Vietnam, we have a concern. There is a new variant developing that is a combination of the Alpha and the Delta. And so that one may be the Epsilon coming, right? So these viruses are built to survive. We will fight hard to control them, but they will learn ways to get around our attack on them.
Does that mean it's likely that we'll be looking at some level of booster shots in the future?
Currently, the way that the pandemic is occurring around the world, the likelihood is that we will probably get a very good control of the virus in Western countries, but we need to do a better job at providing vaccine to every country around the world so that we can control the virus spread everywhere. Otherwise, these variants will keep occurring. And as they keep occurring, then we will need booster shots every year as time goes on.
And certainly, of course, the science will evolve to ensure that those booster shots can meet the needs of any new variants that come along.
Exactly. Yeah. So the mRNA vaccines are incredibly, now that we know how to handle the technology, they're incredibly easy to adjust for new variants that come around. And they're already working on a potential booster that may be required next year.
There are lots of questions that are coming up now about, the answers will be speculative, about what will happen if you do or don't have a vaccine, sort of privileges and restriction. One of the folks is asking about what we've been talking about a little bit, the thought that that if you have the AstraZeneca, that may not be enough to get you into a Broadway show, or possibly even across the border. We haven't really heard that it may not allow you to cross the border, but are we going down the path of more restrictions and or privileges because we're vaccinated?
I think we are going to, and it depends on the country. And again, this is all speculation because this involves politics. Politics can change. Science doesn't change, politics can. The science tells us in order to be fully protected, we need 2 doses of any approved vaccine. All of the countries around the world will have to come to an agreement on which vaccines will be covered. We know that most likely they will include Pfizer, Moderna, AstraZeneca, Johnson & Johnson, and the Novavax one. Until those agreements are in place, you will see things happening like that Broadway show that you mentioned. That is a company by themselves making a decision. They will only allow people that have US approved vaccines into their show.
Mm-hmm.
The Canadian government has made a commitment that they will, and European governments have made similar commitments that they will request that all vaccines that have been used in Europe and in Canada are also part of the approved group, not just the American approved.
It seems likely that there would be a financial impact if they were to restrict the access to their country and their amenities in that way.
Yeah, and so this is why the Broadway show restriction is actually, it's good that it's happening now before international agreements have been made, because it highlights the need to be sensible with our approach. We will need to have folks, if we wish to travel and travel freely, we need to have proof that we've had 2 doses of vaccine. If you don't have any proof of double vaccination, you may be required to go into a 2-week quarantine. at the other location. So, and then each country will have its own rules set up at that point.
So it
But
does seem as if there will be some things that you can or cannot easily do unless you're properly vaccinated.
exactly, and even here locally, we have discussions going on about certain jobs, people working in long-term care, people working in the healthcare system. If they are going to be exposed to people with weak immune systems, like seniors, people with cancer, then all of the workers may be required to mandatory have vaccination.
Along the lines of wondering what may happen next, and this is not around the vaccine, but is there some thought as to to how long we'll be wearing masks and social distancing? And we have guidelines, but will those guidelines be what drives us, or do we foresee this change to be fairly long term?
So our BC restart guidelines that Dr. Henry shared about a month ago are based on science. And the science advises us that if we have large numbers of people vaccinated and we have proof that we don't have that many people getting sick, we don't have that many people going to hospital, then that is an indication that there is very low level of virus being transmitted in the community. At that point, then this is stage 4, which we have now given a date of September 7th, that we will monitor everything until September 7th. If all of those conditions are met, that we have high vaccination rates, and we would like to have 70% of the people vaccinated by then, and our infection rates and hospitalization rates are low, then we don't need to wear masks. Some people are going to be very happy that they don't have to wear masks. Some people will be more anxious. We've been living in this situation for 15 months. It's created anxiety about removing a mask when out in the public. So one thing that we all need to be aware of is to be kind to each other. If you see somebody wearing a mask when everybody else has taken off their masks, we need to make sure that they are not being ostracized or criticized, and we need to give them space to be okay with how they feel. When they're ready, they will remove their mask.
And I think it's kind of interesting because if we look at the influenza rates since the pandemic has started, and we've started to take all these practices around masks and social distances, those rates have dropped dramatically. And one wonders if some of those practices will stay in place just to be and with that kind of a benefit.
Yeah, definitely. We've seen, and some cultures have already been doing this before, and we may see that expansion across all cultures, where depending on the kind of jobs that you do, and where your exposure may be increased for virus transmission, you may want to continue to avoid handshaking. You may want to continue wearing a mask, and that's okay.
There's actually, and while I just want to make sure, there's a question in Arabic in the Q&A. I'm not sure if you saw it or not, but if you did and you could translate it, we'll make sure that one gets answered. Just in the meantime, Dr. Sanghera, just as we start to emerge, what are the things that folks should be thinking about the other health implications that have happened over the last year and a half, and the things they may not have been paying attention to because they simply can't?
Yeah. So with the pandemic, access to family physicians, to nurses has been reduced. Access to cancer screening, health monitoring has been reduced. So we are actually seeing in the last 15 months, people have gained weight. People have higher levels of cholesterol. Their diabetes is less controlled. Their blood pressure may be higher. And because of that, we are also starting to see more risk for heart attacks, strokes, and generally unhealthier bodies, which will impact us in the future.
Mm-hmm.
That's just from not getting your regular healthcare. So I would highly recommend to everybody to continue to meet and talk with your family doctor, even if it's over the phone, so that you can do some simple health screening and health promotion, and continue to control any risk that you may have. The other thing that we have to be also careful of is, and I mentioned this in my earlier discussion, is about the long-term impacts of COVID. So some people had been thinking, it's just a minor virus infection. If I get it, I'll get natural immunity. But you're actually 30% of those people have had long-term implications for their health. And we are starting to see more people with asthma-like reactions after the infection. So they're now having difficulty breathing. They may have to use inhalers for the long term. And we'll continue to watch and see how this develops. We are seeing some links with the virus causing more risk for diabetes, more risk for dementia.
And I think that when you talk about some of the impacts that we may have not yet really fully recognized are around the mental health impact that we all carry. And is there something you can provide with people around sort of advice as to how they might address that?
Yeah, absolutely. So things that we're noticing that people are experiencing after a COVID infection, even if they recover, is a higher level of anxiety. So that's from the infection. This has caused certain difficulties with triggering mental health issues, anxiety, depression, more risk for dementia. The isolation from the pandemic has also aggravated depression, anxiety. And the best way to deal with that is to share that with somebody, to discuss it with friends, family members, and also with your family doctor. The family doctors are available to see you in person, on the phone, or by video.
It's always good to remember. I think we're almost at time. This has been wonderful. Thank you, Dr. Sangera. Thank you, Weil. Were there any other questions that we had in Arabic that we should bring forward?
So the body that is experiencing weakness in immunity and muscles and nervous system, are there any side effects from getting the vaccination? And is the weak body needs specific vaccination? And what is the allergy that the vaccination may cause?
So if somebody has a weaker immune system, the recommendation is to make sure that they do get vaccinated. This will help boost their immune system against this virus. The recommended vaccine for this type of patient will be either Pfizer or Moderna. You will likely have the minor side effects of fatigue, achy body, fever, congestion, mild headache for about 48 hours. But as I mentioned before, this can be managed. And but definitely it is recommended that you get vaccinated. Just because you have a weak immune system does not make you more likely to have an allergic reaction. In people with a weaker immune system, it is more important to get the 2 doses. It is also more important for their family members and close friends that will be visiting to also have double vaccination. We can all protect ourselves by vaccination, but we also protect the people around us.
That's great.
Any other questions, Well?
I have a question. In regards to this material, chemical material that is included in the vaccination, if you can repeat this again, you mentioned that it is also in the cosmetics and in
Yes.
some food. Can you repeat
Yes.
this?
So the
As I
chemical is polyethylene glycol, or
Okay.
PEG. PEG is their shorter name for it.
Okay.
It is found in many cosmetics like lipstick, mascara, foundation, and also in multiple different foods. It's also found in laxative fiber. So I would say the majority of us have been exposed to this in something that we have used.
So the question now, do everyone like who has concerns about the vaccine, do they need to do allergy test before the vaccine or not necessarily?
Not necessary. No, most of us have been exposed to that chemical and we haven't had any issues. It is rare to have that allergy.
And this allergy had different side effects?
If you have that allergy, you may find that your lips become a little bit swollen, maybe a little bit red. You may have red spots on your body. But this is why we ask people to wait for 15 minutes at the vaccination center after vaccination.
Thank you.
Thanks very
So
much.
thank you again, Weil in particular, and Dr. Sangera. I know it's been incredibly valuable. I want to remind people that this is being recorded and will be available on www.burnabypcn.ca. And I think that we're done for today. If you have any further questions, you're certainly welcome to forward them in an email response to the invitation that you got to this event, and we'll make sure that we get that we address them as best we can. So thank you, everybody.